Actually, post-COVID syndrome, yeah, I try to talk in 20 minutes, done it in post-COVID syndrome. COVID itself going to become a new infections, just like dengue, So COVID have become like another dengue. All right. And then you have never hear post-dengue syndrome, right? But there is a post-COVID syndrome. So this is according these books, this guideline. It's called NICE guideline, COVID-19 rapid guidelines managing the long-term effects of COVID-19. All right, next slide. The definitions from the real definitions of the term acute COVID-19, acute. So it's just started, you kena COVID-19, baru kena. Now up to 4 weeks, you have symptom. Up to 4 weeks, you still consider acute. And if you still have ongoing symptoms, sign and symptom of COVID-19, from 4 weeks to 12 weeks is called ongoing COVID-19, means it's the same. With you kena, the virus did not really disappear completely, so it carry on to 12 weeks. Then really after 12 weeks, you still have the sign and symptom, then most likely the virus have already gone, completely, yet it still stay there. So then only we call it post-COVID-19 syndrome. So this is a sign and symptom developed during or after. It mean after you have recover. Then recover, no symptom for 4 weeks. Suddenly there is a symptom come, just like a COVID-19 symptom, consistent with COVID-19. Continue up to 12 weeks and more. Not able, mean cannot be other reason. Kena flu kan, kena flu, so you can hatu kan. But then it's not also flu. It's then considered like it's not due to the other reason. So it's called post-COVID-19 syndrome. And also have present with cluster of symptoms. Overlapping, no single symptoms, is a cluster of symptom which can fluctuate, change over time and can affect any system. So how common is post-COVID syndrome? This is another study show that adults 6 months after COVID-19 infection. We look at the second one. Second one. There is an arrow. There's already an arrow show that. There, the first paragraph in this cohort of individuals with COVID-19 who follow up to 9 months after the illness. After the illness already, follow another 9 months. Approximately 30%, banyak, 30% reported persistent symptom. So this it means every day 30,000 during that hot period, every day got 30,000 COVID active cases. Mean 30,000, 30%, 30% of the 30,000 people every day will end up to be having persistent symptoms. You need expect. This is 30% of them will suffer up to 9 months. The cohort study already end the period 9 months. Finish. Still they have symptom. So don't know they have the symptom until when. If they have the symptom 9 months, 1 year or 2 years, then by medical definition, this is permanent syndromes. Those who are in the hospital, discharged out of the hospital is the one that stay longer, right? 56%, no, this one, I don't know from which country, 56% say have fatigueness after discharge from the hospital, after 4 weeks, on and off, breathless, dyspnea, it's been breathless, cannot breath, penat, sesak nafas, pain, pain here, pain here, stomach pain, cannot sleep, headache, loss of taste, they are persistent, still 20+% still have persistent symptoms, right? Next slide. Next slide is you can see that 58% is still more than 58% have long-term effects after 4 weeks. Fatigueness 58%. There's a lot of symptoms you can see over here. Anemia, memory loss, headache is very common. Those who are a little bit uncommon one, you seldom hear one. Maybe I read for you. Attention disorder also. This one also I didn't hear about. hair loss, can become alopecia. Hearing loss. Wow. Can hear loss. Get fever on it of depression. You can later develop depression, sleep disorder, sleep apnea, psychiatry. The slide one I cannot see already. Dizziness or whatever. OCD, OCD also can. Suddenly you know OCD mean you like cleanliness. Keep on wash your hand. Previously is very dirty one. Suddenly after kena COVID, keep on wash hand. 2%, 2% of them can kena this kind of things. This one, I seldom hear also. I also seldom hear people develop this kind of symptom, post-COVID syndrome, a chest pain, yeah. Okay, next slide. This comprehensive one, it's a lot. So this one, okay, go to the next slide. This one will explain the most common one, according to the organs. Next slide. The first one is the brain. Yeah. So when it attack your brain, the long-term effect, according to the experts, the virus may increase the risk of kena Alzheimer, Parkinson disease. But yet, you see, but government like China, they're still close. They consider this unacceptable. China think that this is unacceptable. How can we let our citizens to have possible to develop long-term effect of increased risk of Alzheimer and Parkinson? So they're still close. They don't allow. But many countries have already announced defeated. They say that, the death rate is already dropped. And also, of course, the economy cannot be forever like that. The economy, they cannot sustain anymore. So they say, this one okay lah. Long-term effect I can accept lah. Eye is less common to have long-term effect, unlikely. Okay, if you are lost nose and mouth is loss of sense and smells lah. Taste and smell can alter your sense, and your taste and your smell can alter the different from last time. Last time are more sharp. Now it's less. Lungs, of course, the cough causing fibrosis, the lung fibrosis, scarring of your lung. Okay, next slide. So usually you can see from your chest X-ray. So the left side is a normal chest X-ray. Right side is both side is haziness. Both lung is haziness. Right, the right lung have middle zone and lower zone is hazy. Then the left lung is periphery side are hazy. So this is a pneumonia type of chest X-ray. And most likely they will send you for CT scan, CT lung scan to see the organized pneumonia of the COVID. Yeah. So this is how many percentage of the lung can develop into the yellow color, the orange color, develop fibrosis of the lung. Mean permanent, scarring, die already, your lung die, one certain percentage die. Yeah. Next, okay, antibiotic, treat complication like kidney failure, cuci pinggan lah. They ask you to monitor yourself, oxygen test, rest, nothing else. Yeah, next slide. So you have to rely on other method to help you. So there's a new study that suggested proposal of food supplement for the management of post-COVID syndrome. Basically, they have run out or don't know what to do. So they call it suggested food supplement. Yes, of course. Why? Because nutritional supplement, no harm. One of the things is no harm, it's not harmful. Why not? Let's try it, isn't it? Yeah, let's try. So you can see that on the second block of the slide, they say what they use. They use L-carnitine, this is CoQ10, hydroxytyrosol, I don't know what is that, actually I didn't check. Vitamin B, C, and D. Yeah, they suggest this nutrition supplement to be used. Yeah, to counter the post-COVID. Basically, B, is for the fat thickness lah. I mean, if you look at this, fat thickness, that you use what? Double X, CoQ10. Vitamin B, yeah, fat thickness is the most common. Cough, the lung. Don't you want to use? Use turmeric, vitamin C. Let's see what is your what organs that involved. Yeah, headache, painful, headache, omega fish oil, calcium, magnesium, yeah, vitamin B, yeah, and nerve loss, smell, all the nerve confusion, lost smell, yeah, all these things is all, and insomnia, all using B, calcium, omega fish oil, and protein. All right, next slide. So, so the study has been say that it useful in acute COVID. Basically, vitamin D is useful in acute COVID. So they might be useful for post-COVID, right? Vitamin D. Magnesium, yes, magnesium. So found that the magnesium can improve vitamin D absorption, yeah, significantly. If you don't have taking magnesium and just take vitamin D itself, you need 146% more vitamin D to reach 40 nanogram per ml than those who take magnesium together with vitamin D. Right, next slide. Next slide is quercetin. Quercetin you can find in XX and concentrated fruits and vegetables. Was ranked at the 5th best compound. They got first ranking. I need to go and find 5th best compound out of 18 candidate assessed to interfere with SARS-CoV-2 replication. Quercetin can actually interrupt COVID beranak. Hentikan dia beranak. Okay, next slide. Next, zinc. Yeah, zinc. Well known also. The study with thousands and thousands of people and show that it have efficacy against COVID virus. Okay, next slide. Vitamin C, of course. Vitamin C also. Well known, everyone buy vitamin C, just want to help them to protect from COVID-19. Next slide. And bioflavonoid, luckily we don't have to buy 2 bottles. Our vitamin C has bioflavonoid because it can increase absorption. Bioavailability, yeah, can increase, yeah. And then you see the second paragraph, liposomal vitamin C is actually, we are using this technology, yeah, can increase the bioavailability of the vitamin C by nearly 50%, yeah, more extra 50%. Wow, better than the other vitamin C. That's why I always say that each of the vitamin C is different. Next slide. So basically, that's the one that we suggested. Vitamin C, omega fish oil, XX. Second slide. Turmeric, either protein or collagen or both. Yeah, because protein, we need protein. Collagen is part of the protein also to build up your body.